And we're live here at the 2014 ACC Legislative Conference. My name is Shashank Sinha with the Fits on the Go blog, and I have the pleasure and privilege of having with us Dr. Michael Lauer, the Director of Cardiovascular Sciences at the National Heart, Lung, and Blood Institute. We just heard a very compelling presentation, thank you so much, on the importance of biomedical research and the perspective from the NHLBI. Dr. Lauer, I was wondering if you could comment and elaborate a little bit more on what the most important area of research within the NHLBI should be for both intramural and extramural funding as we lobby here on Capitol Hill.
Thank you. I think one of the most important messages to bring is that we support a wide diversity of research. We fund basic research. Basic research will enable us to figure out new mechanisms by which we could potentially prevent or treat cardiovascular disease. We fund clinical research, including clinical trials. We're interested in translational research, figuring out how to translate the results of basic research into interventions we can use for patients. And we fund population research. I think an important message for all of us is that we fund a wide diversity of research, and it is by doing that that we will ultimately lead to progress.
And one of the most exciting ventures that you mentioned in your talk was on the importance of registration trial registries, randomized trial registries. I was wondering if you could elaborate more on the impact of comparative effectiveness research in this regard.
Sure. So cardiology, one of the reasons I went into cardiology was because we invented the mega trial. We invented large-scale clinical trials. And I remember when I was in training in the 1980s and then later on started practice in the 1990s, it seemed like there was one mega trial after the next, week after week after week. And in this way, we were able to revolutionize the way we take care of our patients. Problem is, of course, as many of you know, clinical trials have become prohibitively expensive. And so we're losing that art. Now, through the great work that ACC and other professional societies have done, it's now possible to conduct large-scale trials at very low cost by leveraging these registries. And I think this is an opportunity where we could potentially take a shrinking pie and turn it into a rapidly expanding one, and in this way make it possible for cardiology to go to even greater heights than it already is.
And last but certainly not least, I was wondering if you could elaborate on the emerging challenges and opportunities for the NHLBI within the next fiscal year and beyond.
Well, I don't think there's any great secret to say that funding is tight. In fact, NIH funding has been in a state of steady contraction for at least the past 10 years. At the same time, the opportunities are amazing. This is because of rapid improvements in technology, increasing integration of healthcare, the advent of big data, the increasing interconnectedness of our world. And so even though the fiscal market is shrinking, our opportunities to transform our business models and do things in even bigger and better ways are greater than ever. So I think this is, despite all the challenges, or perhaps because of all the challenges, we're now actually at a time where we could transform research and take it to even higher and higher levels.
And finally, for the FITs in the audience who are aspiring young investigators, what advice do you have for them?
Follow the fire in your belly and work hard.
Thank you very much. Truly a pleasure.
Great.